Lymphatic fluid is tissue fluid that originated from the blood. All right, so if we have our arterial end of the capillary bed, this diamond shape would be the capillary bed. We look at a component similar to the filtration pressure we talked about for the urinary system. So our arterial end is coming closer to the heart, coming closest to the heart. So it's going to have a higher blood pressure or hydrostatic tension on the arterial side of the capillary bed than on the venous side of the capillary bed. So we're going to have higher hydrostatic pressure on this side, or blood pressure, and on this side we're going to have lower, and we'll talk about why. Oh, what's the blood pressure? All right, so when we talked about the filtration system of the kidney, remember we had albumin, and albumin had a reverse effect. It had an oncotic effect to keep the fluid within the blood vessels. And so on this end, we're going to have albumin from the liver still. And on this end, in comparison to this end, we have lower oncotic pressure. Okay? But the hydrostatic pressure is going to push water across our capillary walls. And that's leaving the cardiovascular system and decreasing blood volume. Now, as we move to the venous side, we've lost water, all right? We're farther away from the heart, and so both those reasons, blood pressure is lower. We're farther away from the heart, and we've lost fluid. Because we've lost fluid, our albumin is in a higher concentration. We don't add any more, but just for the number of albumin molecules per volume of fluid, we have more of them, okay? And so on this side of the capillary bed, we return water to the blood, but not as much as we lost. And so if we don't fix this, we end up with increased extracellular fluid, which leads to edema. Okay? So that then is what is being picked up by our lymphatic capillaries. The lymphatic capillaries are blind ending. Here our blood capillary is open at both ends. This is flowing from arterial to venous vessels. But our lymphatic capillaries, found in the same area as our blood capillaries, are also formed of simple squamous epithelia, but they are rather loosely attached, and there's little collagen fibers that kind of attach to them. And as fluid builds up, that opens up spaces between those capillaries, the capillary cells. And as fluid increases in pressure here, that's going to cause water to move into the lymphatics. Those gaps are large enough for white blood cells. If there's any tumor nearby and it starts to metastasize, this is how this usually happens. Tumor cells separate from the original primary tumor and move out into the extracellular fluid, and they're taken up into the lymphatic capillaries. And if there happen to be any bacteria or viruses, they're going to be taken up as well. The only component you're not going to see in here are red blood cells. I suppose if there was a bleed and a bruise, you might see some, but typically they're not a normal component of our lymphatic fluid. White blood cells, tumor cells, fluid of course, bacteria, and viruses. So these lymphatic capillaries now contain a lot of stuff that we don't want to put back in the blood. The blood is supposed to be sterile. So we don't want to be dumping bacteria and viruses into the blood. Lymphatic capillaries join together to form larger vessels. These would look like postcapillary venules. So it's really hard to tell. They have a very thin, smooth muscle wall. So sometimes you can identify, if you don't see any red blood cells in them, you could say, well, okay, they might be a lymphatic. If they have a red blood cell in them, they're definitely not. So you can only say it's a possibility if you don't see red blood cells, okay? So these yellow lines on this, I call this the red band model. These represent the larger lymphatics. And of course, they're flowing back up to the thoracic cavity so they can contribute that fluid back to the fluid of blood. And along the way, they pass through these yellow oval structures, which are the lymph nodes, okay? Several different times. So they don't just go through one lymph node and the fluid is considered cleansed. They're going to go through multiple lymph nodes along the way. And so lymph nodes, we have a couple of models illustrating lymph nodes. And you may have felt a swollen lymph node along your neck area or in your armpit if you had a sore throat or something or an infection. And so they're kind of shaped like this with a convex surface and a concave surface. And the vessels carrying fluid into the lymph node are considered to be afferent lymphatic. If you use that term in Bio 430, neurons carrying impulses towards the spinal cord are afferent. And you can also tell by the shape of the valve. So if you have a lymph node, and we have lymphatics coming in this direction, the valve is going to be directed to allow flow towards the lymph node, okay? The smaller concave surface is carrying lymphatic fluid away, and therefore the valve is shaped to allow fluid to leave. So these are afferent lymphatics. And by the way, the lymph node is the only lymphatic organ to have afferents. And these are efferent. Lymphatics. But if you consider it, this efferent lymphatic, when it gets to another lymph node, at that time is going to be an afferent lymphatic. And I have no idea when we change its name, how many inches are away from the lymph node we have to be to change the name. All right, so lymph nodes and other organs of the lymphatic or immune system then are a dense collection of B cells and T cells, B lymphocytes and T lymphocytes. And this flow of lymphatic fluid then filters through those and allows macrophages, dendritic cells to come in contact, phagocytose and present particles of the antigenic surfaces, and we'll learn about that on next week, to the B cells and T cells to see if they're able to recognize them. And then they flow through and leave and go to the next lymph node, okay? So these circles here are spheres of condensed high density of lymphocytes, along with macrophages in the flow spaces. You could call them lymphatic nodules, but I use the term follicle because like our interlobar and interlobular vessels in the kidney, it can be confusing. And even some textbooks mean to say nodule and they print node. So if you use the word follicle, then you don't get that confusion, all right? Now, in the lymphatic tissue, I started talking about this separate cells that are not as organized, are not surrounded by a capsule. So when you look at the microscope slide of the intestine, you're going to see that, but we also have this lymphatic tissue model that shows not the diffuse lymphatic tissue. So diffuse lymphatic tissue, the B cells and the T cells, but you can't tell the difference in the light microscope, are going to just be dense but not highly concentrated. Lots of purple nuclei filling in the loose irregular connective tissue. and some of the denser red are down here. And that's what we call the diffuse. So no organization, just a lot of lymphocytes. Because this is close to the surface, and this is an area that bacteria and viruses can pass through. Then here's an example on the model of the small intestine of a lymphatic follicle. It's not made accurately because it's supposed to be lighter in the middle, and that's called a germinal center. Anybody know why it's lighter in the middle?
Plasma from the B cells?
Yeah. So a typical lymphocyte, when you look at the blood cells, when it's in the blood, most of the volume of the lymphocyte, and this is, I can't tell whether it's B or T cell at this point, is taken up by the nucleus. If this is a B lymphocyte, then it gets exposed and reacts, and its receptors match an antigen, and it starts to make plasma cells to release antibodies. Then it converts to a plasma cell. And a plasma cell is making antibody proteins. So it's going to have a lot of ribosomes and a lot of Golgi, but because it has more cytoplasm, it's not as dense or dark. And so that increased area of cytoplasm lacking a nucleus looks lighter. And so we find B cells, whether we're looking in the tonsil or the lymph node or the spleen or a lymphatic follicle, we see the lighter center in the middle if there are plasma cells present. Okay. Once the lymphatic fluid reaches the chest wall, I'm running out of space here, all the different lymphatics will flow into it's about 1.5 inches in size. So from the pelvis, from the lower extremities, abdomen, pelvis, they're going to flow into this structure known as the cisterna chyli. And then that will move up the right side of the chest, along with the hemizygous vein. And at that point, it's called the thoracic duct. We're not filtering it anymore. And it's going to empty into the subclavian vein. And now finally the fluid that we've collected and filtered is back in the cardiovascular system. All right, so the thoracic duct does right head, neck, right upper limb, right chest, sorry, left, the wrong side here. Left head and neck, left upper limb, left chest, and move it over here. All of the abdomen, pelvis, and lower limb. Okay. The right head and neck, right chest, right up. Oh, did it again. Left upper extremity, and abdomen, and pelvis, and lower limbs. Then we have about 1 inch to 1.5 inches right lymphatic duct emptying into the right lymphatic subclavian. And this is going to come finally, right head and neck, right upper limb, and right chest. So if there's lymph nodes from the mammary gland, all right, or the lungs are going to come into the right lymphatic duct. Why it's such a disparate, only this part is done for the right thoracic duct, I have no idea why it's so much smaller than everything else. And you can see those on this model, okay? The thoracic duct and the right lymphatic duct. A little aside, yes?
So for the right lymphatic duct, would it be just this or
Yeah.
just from here down?
It'd be just the right side of the head and neck. Yeah, right side of the neck. All of the right upper limb and the right side of the chest and cavity. So when I was teaching at the med school, we had a few students that were retaking the first year, so retaking their gross anatomy. and, which makes their answer a little more surprising, but maybe that's why they had to repeat. There were multiple choice questions, and then there were essay questions. And one of the essay questions was identify the vessels of the chest. And they had to be complete sentences. And this student made a table, which wasn't a complete sentence, and then wrote, there are 4 birds in the thoracic cavity. There are the right lymphatic duct, the thoracic duct, actually 5, the azygoos, the hemiazygoos, and the accessory hemiazygoos. And we're like, what? But that was that was a great way to remember it, but they're not really birds. When you're answering an anatomy exam, to say there's 4 or 5 birds in the chest wall is funny. All right, so for this model, talk about this model. We have a plasticized tongue. I'm assuming it's from a cow or bull. So you can see the lingual tonsils right here on the posterior aspect of the tongue, and then the palatine tonsils. And on these head models, you can see, of course, the same thing. You can also see the nasopharyngeal that we talked about for the respiratory system. Lingual, again, is not yellow, but it's on the posterior surface of the tongue, and the palatine. Okay. And then the only other, I guess I already pulled up the intestinal component. Okay. Spleen, pretty easy to recognize. It's tucked up under the diaphragm on the left side. So this would be the spleen. You probably found it when we were talking about the splenic artery. Okay. On the spleen, it's the only organ we have that filters blood. Okay. It also stores red blood cells. So you actually, if you have to have the spleen removed, because it's very easily breakable, friable, it's just a bunch of cells packed together. So if it's damaged in an automobile accident, sometimes I'll just take it out rather than try to stitch it back together. It's kind of crumbly, like frozen cheese or cottage cheese or something. So with that gone, you lose 2 functions and 2 symptoms. So without the ability to store red blood cells, there can be increased fatigue because you don't have, this is a natural blood doping, okay? It's really only been proven in animals, but I always think when I get a stitch in my side when I'm running that, there's new red blood cells being squeezed into my splenic artery, because we do have smooth muscle in the capsule of the spleen. And then, of course, the other function would be to filter the blood with the lymphatic structure. So one thing I just wanted to mention, and I'm running out of space here. So with the spleen, of course, we have blood coming into the spleen because of the splenic artery. And you have regions of the spleen with lots and lots and lots of red blood cells, known as red pulp. And then along these vessels, we have more cylinders rather than spheres of, so they're like lymphatic follicles, but they form a cylinder of B cells and T cells, known as PALS, or peri-arteriolar lymphatic sheath. And if you look at that in a cross section, you'll see the central arteriole. And sometimes it's offset to the side, but it looks like a lymphatic follicle with just a major blood vessel inside of it. So when you're looking in the spleen histology slide, you'll see it more like this than like this, okay? And that's the view of the PALS. And you can tell if you see a blood vessel inside it that you're in the spleen, okay? So with the spleen removed, you lose the ability to store the red blood cells, and you lose the ability to filter the blood. So you're at risk for an infection, bloodborne infection. In fact, if a dentist is doing a procedure on you and they know that you've had your spleen removed, they'll prescribe antibiotics to take before you come in for the procedure, just to make sure that if you do get bacteria, because it's most dental procedures start some bleeding, and so if you do get bacteria from the mouth into the blood, you don't have to worry about not having the spleen. Alrighty? Okay. So you already heard all that, if you listened to that, if you finished listening to the video, but I'm not sure that you have with the test and everything, so I wanted to make sure we're on a common basis there. So the histology over there, and then the various models, and this is what your lab quiz will cover on Tuesday, okay? I've also, this evening, just before office hours started, I uploaded a practice lab quiz, like I've done for exams before, on identifying what white blood cells, models, and histology of the immune system that you can review over the weekend. If you find the basophil, I'll bring Twixes on Tuesday.